share my slides. So today we'll learn about what we mean by perioperative nursing. Okay, is it visible? Yes?
Yes, ma'am.
Yes, ma'am.
Okay,
Yes,
so
ma'am.
actually what happened, whenever we say perioperative nursing care, so actually this is that care as a nurse which we have to do, okay, especially during the surgery period. So whenever you hear the word operative, that means it indicates when the patient undergoes any form of surgery, operation. Yes, you know now what do you mean by operation? Yes or no? We used to say no every time. A person operation. You know on that surgery and all?
Yes,
Yes,
ma'am.
ma'am.
Yes, okay. So as a nurse, actually, you all know that as a nurse, we are involved in all aspects of patient care. We are always there with the patient 24 hours, okay? So in this perioperative nursing care, we will discuss about what are the various role as a nurse we have to do during the entire operation process. Be it pre-operatively means pre-operatively when we say it is that period that occurs before a person goes for a surgery. Okay, that period we call it as a pre-operative phase. Okay, and the second is called the intraoperative. In the intraoperative, what comes? So that is that duration of times when the patient is undergoing the surgery. So during that time also, we have some roles which we have to do as a nurse. And post-operative means after the surgery is done. So in all these three aspects or three phases, so all these three phases are included when under the word perioperative nursing care. So under perioperative nursing care, usually it have three phases. We have the pre-operative, the intraoperative, and the post-operative. So when we say perioperative, that means that is the care which as a nurse, which we have to do or for our patient during the entire period of operation time from the patient just the time before the patient go for surgery, during the operation and after the operation. Okay, so in simple, before starting to directly to my topic, so I'll just briefly tell you what do you mean by a surgery. Okay, so a surgery actually it can be defined as the art and science of treating disease, injuries, and deformities by operating and instrumentation. So that is the main reason why we do surgery. Whenever suppose if you have any injury that needs to be repaired or needs to be stitched, or if anything needs to be removed, for example, appendectomy. So whenever a person have appendicitis, okay, so that means whenever your appendix gets inflamed, so if you don't remove it, what happens? So later on, if it bursts out, or then the infection might spread to the other parts of your body. So those type of things, we need to remove it as fast as it's possible. Okay, so those type of situation, we need to remove a certain parts of the body. So that is for treatment of the patient. So these are the things which we do in the surgery. Actually, we do perform some operation. Okay, so when we say about surgery, so these are some of the words which you will, why I'm giving this, because time to time you'll be hearing these words. Okay, when any during any surgery, or any if the patient undergo any form of surgical procedures and all, so time to time you'll hear these words like ectomy. Okay, so whenever you hear this word ectomy, that means something which we remove. Okay, for example, appendectomy means we are going to remove your appendix. As we all know, okay, so appendix actually it is that organ of the body which does not have any function. So but sometimes what happen, when in some situation it becomes inflamed. So one, it becomes inflamed means it will cause lots of pain to the patient. So in that cases, what happened? So in order to treat the pain and to avoid any other form of complications, so we remove that. So that is called as the appendectomy. So whenever you hear the word ectomy, means something which is removed or excise. Okay. The second is lysis. Lysis is something which we destroy. Okay. So for example, when we use chemotherapy drugs and all, so we are trying to destroy the cancerous cells and all. So that is the meaning of the word lysis. Lysis is something which we destroy. Okay. Then ostomy. Whenever we say ostomy, it is a creation of an opening in two. So for example is colostomy. Okay, so I'll show you the diagram. So if you see in this first diagram, what happened? So that is called as a colostomy. Okay, a colostomy, it is an opening which is made into the small intestine or into your intestine. Okay, so why do we do this? Because suppose if a person already he have any cancer of the stomach or cancer of the small intestine or large intestine. So in that case, so some parts of his intestines needs to be removed, okay, and because of that, so he cannot that the normal process, how normal individual used to defecate and all through the intestine, so that cannot be done, right? So because of that, they used to put a pouch that is called as a colostomy pouch. So all those will be collected there, whatever okay, whatever contents, stomach contents and all, so all they will be collected in a pouch, and this pouch actually it needs to be uh, daily, okay, they needs to replace the pouch. So this is a colostomy, okay, so this is usually done whenever the individual have any intestinal problem or intestinal surgeries now. Okay, sometimes what happen, sometimes the individual they might have done some repairment of the intestine, so for the time being the individual's intestine needs to be like, we can like, it needs to be on in a rest, like we need to rest that for healing and all, no? So for that purpose, so they used to make this colostomy. Or in a patient who's having any form of cancer in which some part of his intestine needs to be removed, okay, so in those type of patient also we usually do for this colostomy, okay. So colostomy, it is an opening. Then when we say otomy, otomy, it is a cutting into or incision of, for example, is a tracheostomy. Okay, so tracheostomy is a second diagram, okay, which is mostly done in the neck area. So this is usually done, especially if there is any obstruction in the respiratory tract. So in order to help the individual to breathe again, or in order to remove any form of obstacles, okay, to help providing adequate amount of oxygen, so they used to provide this ostomy, okay, tracheostomy, sorry. So this tracheostomy also likewise, it needs to be clean every day, okay, we need to take care of this properly, we need to do some suctioning because in between some, okay, so we have to take care all this. So this is actually what is called as a or tracheotomy. So whenever you heard this otomy, means it is a cutting into or incision to. So after you see in the diagram, after that hole it is made in the neck area. Okay, so after that they usually put that tube. The tube which is inserted, that we call it as the tracheostomy tube. So this also you learn, you will see when you go for the clinicals posting and all in the hospitals and all, some patient they used to have this tube, okay, so we call it as the tracheostomy tube. So that is the meaning of the word otomy. And plasty, whenever we say plasty, means it is a repair or reconstruction. For example, tympanoplasty, or even days to tympanoplasty is actually what happened inside our ear. We have a tympanic membrane or the eardrum, okay. So in some people, what happens because of some maybe because of accident or congenitally only from their birth, they would have some problem with that, so they used to repair it. So that is called as the tympanoplasty, okay, where they used to do some form of repairment or reconstruction, okay. So these are some of the suffixes which we usually describes in so many surgical procedures, okay. So this I'm just giving you briefly so that at least you'll have what is a brief idea of, okay, whenever you hear this word or ectomy or lysis or otomy and all, okay. So actually when we say about surgery, okay, so we have these three main division of surgery. So according to the purpose, it is divided into diagnostic, palliative, ablative, reconstructive, cosmetic, transplant, curative, restorative, reparative, and preventive, okay. So according to the degree of urgency, it means something whether the surgery needs to be done immediately, or whether we have to wait for some few hours, or some whether it can be done at any time. So that is the meaning of urgency, means how, whether the surgery it is a very immediate one or it is a non-immediate one, okay. So under this urgency also we have the emergency and the elective. So under the emergency also it have immediate and urgent, and elective we have required, recommended, and optional. And the third types of classification is called as a degree of risk, okay. So that means when we say degree of risk, that means how much it will really affect the individual's life, whether if doing the surgery, whether his life, how much is the risk associated with his life, okay, after doing the surgery. So that is, again, we have divided it into a major surgery and a minor surgery, okay. So we have these two types. So these are the three main classification of surgery, okay. We have according to the purpose, according to the degree of urgency, and according to the degree of risk, okay. So all of these I'll explain, okay, one by one. So the first one, according to the purposes we have, is the first one is called as the diagnostic. Okay, so what is a diagnostic? That means these are those surgery which we do in order to do for the confirmation of any form of diagnosis, or to know whether from what type of disease a particular individual is suffering. So in order to know that, so they usually used to perform these type of surgery. So this is an operation in which the diagnosis is unknown. Okay, and so it confirms or establishes the diagnosis. Okay, so diagnosis is something like what is the name of the particular disease a person is suffering. So by doing some form of exploration or by doing some dissection, so they will be able to know what is the exact cause of that patient's problem, or what is the exact cause of that individual disease. Okay, for example, here is example, a biopsy of a mass in the breast. Okay, suppose a biopsy, actually it is a small amount of part of that particular organ which we used to take, and this we used to send it for testing. Actually, this biopsy test is usually done if we are suspecting anyone having from any form of cancer. Okay, so actually breast cancer is very common among the women. Okay, so what happens? So in order to confirm, if suppose already, if the girl is already having all the other sign symptoms, so if there is any form of bleeding, if there is any lump, okay, suspected in the breast during ultrasound and all. So what happens? In order to give more confirmation whether it's really what type of whether it is cancerous or non-cancerous, so they will take a little bit of a tissue or some sample from the breast, and after that they will send it for biopsy. Okay, so that is a simple example of a diagnostic, this one, surgery. Okay, so the second is a palliative. So this is an operation in which the symptoms are relieved, okay, but the basic cause remains, and so does not cure the disease. So remember, whenever we say palliative, it is, for example, it is that situation where already the patient is already, he's already in the last stage of his illness. For example, a cancer patient, he's already enduring, he's already having the fourth stage of cancer. That means he's already in the last stage. So in these type of patient, what happened? We cannot cure his problem, but still what happened? We will try to reduce the symptoms. Okay. So yes. Anyone have any question? Yes. Please mute your microphone. Who is that? Keep your microphone muted. Okay. Unless if you have any question. Let me see who is that. Okay. Gargi, please mute your microphone. Okay. Don't keep it on like that. Okay. So that is called as a palliative. So, for example, is an insertion of a gastrostomy tube to compensate for the inability to swallow. Okay, so as you can see from the diagram, that is a gastrostomy tube. Okay, so suppose if anything, if some, because of some reason the child or the individual is unable to take the food orally, okay, so they will give it through the tube. So this tube, actually what happened, it will go directly into the stomach. So that is simple example of a palliative care. Okay. Then the next is ablative. Ablative, this is an operation in which the diseased body part is removed. For example, removal of the gallbladder. It is called as cholecystectomy. Okay, a gallbladder is actually, it is a part of your digestive system. Okay, then where all the bile juice is being stored there. I think this also you learn more when you learn about the digestive system more. Okay, and another example is your appendectomy, where we remove a part of the entire part of the appendix. Then the next type of surgery is called the reconstructive or the cosmetic surgery. Okay. So this is an operation which is done to restore the function or to restore any appearance that has been lost or reduced. For example, a burn patient. So after a burn, what happened? The patient, okay, after a burn injury, so the patient's face might be disrupted, or he might be, okay, so she might have so many injury in her face or other parts of the body. So in order to repair or to reconstruct that, they might do some reconstructive surgery. Okay, and for example is the facelift. Okay, so if they want to look more young, and also they used to do facelifting, mammoplasty, it is for the like breast implant and all those comes under the reconstructive. Okay, reconstructive or the cosmetic surgery. Are you clear till now? Yes.
Yes, ma'am.
Cosmetic surgery, I think you have
Yes,
heard,
ma'am.
right? Especially in Korea, yeah, in Korea. Okay, so Korea is a very hot spot for cosmetic surgery. So there, cosmetic surgery, like so many different types of cosmetic surgery are done, and it is quite in a very reasonable price. Okay, so many people go there, and they have good specialists and all for cosmetic surgery and all. So even in our country also we have, okay, some hospitals who are doing this cosmetic surgery. So some patient, for example, a patient with burn and all, right, after having any type of burn injury and all. So in order to help, at least, because with, if we try to repair a bit and help in reconstructive constructing her face and all, so it will give them the confidence and all, because obviously after a burn injury, especially if you're having any burn on the face and all, so it will really affect the individuals, right? Some of them, they might go directly into depression, they might, so many aspects it affects. Okay, so in those types we used to do this reconstructive or cosmetic surgery, or somebody who they want to look young, okay, so they will try to go for a different type of this reconstructive surgery. So then the next is called transplant. Okay, so this is an operation in which deformities are corrected and malfunctioning structure are being replaced. So I think you have heard of transplant, kidney transplant and all, yes or no?
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
okay,
ma'am.
even in our
Ma'am.
downtown, okay, downtown hospital, actually we have this kidney transplant, and just recently also they have started with liver transplant, which is the first in Northeast, okay, so it is the first hospital which is doing this transplant, liver transplant. So in a kidney transplant, what happened, you all know, right? So kidney, actually an individual, he can survive with one kidney. So what happens, so if you have any family members with it, they will first, before doing the transplant, they will do some matching procedure and also to see whether your blood group is matching or any matching compatibility, we used to say compatibility test. Okay, so if it match, then they can proceed for the transplant. So this, actually, it is usually done if an individual is having any chronic kidney disease. Okay, and when the, you know that kidney, actually the main organ which really helps in filtering and removing any form of waste product inside our body. Okay, so what happens if the kidney fails, that means all these waste product, it will be accumulated all over the body, and the body will swell up. Okay, all those, and the person's also, even the urine output, it goes down. So in those type of individual where there is no other option, okay, where so they have to replace that particular organ. So even kidney transplant is done. Heart transplant. Have you heard of that? Heart transplant. Heart transplant is also done. Okay, but for heart transplant, so those are usually done not on a live patient. Okay, so when before, like some donors are also there. Okay, so we have so many organs, so that we, like eye donation, eye transplant is also done. Liver transplant also, it can be done. Okay, so bone marrow
Ma'am,
transplant. Okay, bone marrow transplant
ma'am,
also is, yes.
ma'am, what about the donor in case of liver transplant?
What donor? That one also they will do first the compatibility test. Okay, in compatibility test, so many testing they used to do. Now they will do the blood test. They will see whether, because what happened if the donor and the recipient, okay, if if they don't have the 100% compatibility, what happened after, suppose after you have transplanted that particular organ into that particular individual or the recipient, then some rejection might occurs, and so many complications might comes afterwards. Okay, so that's why we have to, they used to do this compatibility test. Okay, before any, even for blood tests also, actually we used to do the, before donating any blood. Okay, we always do this compatibility test. Yes, so both, actually both the donor and the recipient, okay, we have to see whether they are fully, they are matching or not. So only when it match, then only they will proceed with the transplant. It's quite a bit risky, okay, and so many after, because what happened if you put anything inside your body, it is something which is, it is not a part of your body. So our body act as it reacts to that particular organ or to that particular whatever it is being transplanted, it react it as a foreign materials or a foreign substance. So it takes time for our body to be accumulated with that, right? So that's why we have to do so many different compatibility tests, okay, before and doing any form of transplant and all. Have you heard of a face transplant, yes or no? Yes or no?
No, ma'am.
No, ma'am.
You
No,
know that
ma'am.
face
No,
transplant
ma'am.
can be done. Okay, if face transplant, actually, it was not in India. I have not, but in other foreign countries they have started. Okay, the entire face will be transplanted to another individual. So I have seen some documentaries. Now they used to do this face transplant. So nowadays, actually, transplantation, so many. If you know about organ donation and all, no? So many. Even you all also now, also if you want, okay, you can be a donor. So some actually some organs can be donated when you are still alive, and some, okay, only when you are dead, then you can donate. Okay, so even face transplant also there is to do. Even arm, face, then this hand transplant. Have you heard? Have you seen any documentary? No. Hello, am I audible?
Yes, madam.
Yes,
Yes,
ma'am.
ma'am.
Okay, I got disconnected. Okay. What was my? Okay, so actually, nowadays we have so many different types of transplant, which is done. Okay, so all those are there. So whenever we say transplant, we try to replace that, like if anything which is already destroyed, okay, we try to replace that. So if the kidney, suppose if the person kidney, if he's having any kidney problem, if the kidney is not functioning anymore, they will replace it with a new kidney. Okay, so that is the so till now the scientists are still working, okay, how to transfer till now with brain, okay, brain it cannot be, we cannot transplant till now, okay, so they are still working on how to transplant a brain transplant, okay. So those is all about the transplant or corrective surgery. Then curative surgery. So this is an operation in which the complete cure it is ensured by removing the diseased part or the organ. For example, is appendectomy. So like I've already said, so since mostly, if you remember, also I have mentioned that appendix is doesn't have any particular function in our body. Okay, so if it is causing a problem, if it's inflamed, so we can directly remove it. Okay, so by removing it, what happens? So after removing it, the person will be fully cured. She will not have any pain anymore. Okay, so she'll be able to continue with her normal life. So that is all called as a curative surgery. Okay, so that means when you remove that particular organ, the persons will be cured. So that is called as a curative surgery. Okay, so the next is reparative surgery. Okay, so this is an operation in which a repair of the damaged or injured part is done. For example, I think you must have seen, right? Suppose if you have any cut, suppose in your skin or anywhere. So if it is a bit big, we used to go to the hospital and we used to do stitching. Yes or no? Yes?
Yes, sir.
Suturing
Yes,
means
madam.
one they used to
Yes.
stitch na with the we have some specific this thing. So that is called as reparative. So by that's when we sutured any particular part of our body, that is called as a reparative. So we try to repair it. Okay. So restorative means it is an operation which is involving strengthening of a weakened area. Okay. So here, if you see in the diagram, okay, actually, what are those? So those are called as hernia. Okay. So what happened? These hernia actually they are abnormal. This one, these hernia they are a bulging of an organ or tissue through a very abnormal opening. So these are very common. Suppose after any surgery or if because of some problems. Okay. So the person might have these hernia. As you can see, the one in the umbilicus that is called umbilical hernia. So abnormal bulge, it is a bulge type. Okay. So in these type also what happens? So they used to do some form of surgery. Okay. So when we say herniorrhaphy, so this is actually it is done in the hernia. Hernia which can be in different parts of the body. It can be an umbilical hernia, it can be an inguinal hernia, femoral hernia. Okay, so these are the meaning of the word restorative. Means they will try to adjust to make to keep the bulge, whatever is there, enlargement is there. They will try to insert it, not in, but fully it cannot be inserted, but still they will try to strengthen it so that otherwise if you keep it open, okay, it will become more and more bulge, and after that it will become more and more sagging. Okay, that means hanging down. So that is called as a restorative surgery. Then preventive surgery, it is an operation which is performed to prevent the disease. For example, is simple example is removal of a mole to prevent it into turning into malignancy. When we say malignancy, that means it can be cancerous or it can be non-cancerous. Okay, or mostly it is cancerous. So in order to prevent that, we used to do some removal. So, or for example, already if any individual is already having a sign and symptoms of cancer in one breast, so in order to prevent the spread of that cancerous cells to other part of the body, in some situation what happened, they will remove the entire breast. Okay, so that is a simple example of preventive. So by removing that, they will prevent the disease occurrence, or they will try to prevent the spread of that cells or that cancerous cells or any infection to other part of the body. Okay, so that is called as a preventive. So according to the degree of urgency, so we have emergency, as well as we have elective. So whenever we say emergency, that means these are some situations which are very life threatening. That means we have to do the surgery immediately in order to save the life of the patient. So for example is, suppose an example is a patient comes after an accident to the hospital with a injury in the head. Okay, so you have some injury in the head. So because of that, what happens? Some internal bleeding might occur, okay, which it might go inside his head. So because of that, so there's sometimes we need immediate surgery we need to do, because in order to save the life of the patient. Okay, so a simple example here is a, like, suppose an acute appendicitis. So acute appendicitis is nothing but it is the inflammation of the appendix. Whenever you hear the word citis, okay, citis means it indicates inflammation. Appendicitis, okay, so this means inflammation. So in this, what happened if you don't remove the appendix on time? So this appendix, okay, what happened in time to time, because inflame means it becomes very red, it becomes bulge or increase in size. Okay, so there will be a point of time when this appendix will explode. So if it explodes, what happened? So it might spread the infection to other parts of the body. So in this type of situations, we have to do immediate surgery. So emergency surgery needs to be done, otherwise it will cause serious complication. Okay, so under emergency also we have immediate and urgent. So when we say immediate, means the surgery needs to be performed immediately. Okay, so within 1 or 2 hours you have to perform the surgery in order to save the patient's life. For example is acute appendicitis, or to remove any form of complication later. Then urgent means the surgery needs to be performed. It can be done within 24 to 48 hours. Okay, so in those type of situation, we will do the urgent surgery. For example, urethral calculi. Okay, calculi means it is the accumulation of stone in the urethral. Urethral, it is the tube. Okay, where it is connected to the urinary bladder. So in this situation also, what happened? We need to do urgent surgery. Otherwise, it might cause so many complications later to the patient. Okay. So elective surgery means these are those surgery which has already been planned. Suppose already they have already planned, okay, on this day, on a fixed day, on this time, you'll have to come to the hospital for the surgery. So this is called as elective or the planned surgery. For example, hemorrhoidectomy. Have you heard of hemorrhoids? Yes or no? Or
No, ma'am.
piles? Piles, you know or not? Piles, where people used to have mostly, okay? If a people have
Yes,
constipation
ma'am.
and all, that's why they
Yes,
say,
ma'am.
right, we should not strain so much, because it might cause piles and all. Okay, so hemorrhoids is the other name of, it is in medical term we call it hemorrhoids, but in normally we used to call it as piles. Okay, so in that also what happened, because of the straining and all, so some extra enlargement or some extra bulge used to come. Okay, so those they used to remove it, so that is called as hemorrhoidectomy. Okay, so under elective also we have required, recommended, and optional. So once we say required, means the surgery is performed within weeks or months. That means required means this surgery needs to be done only. Okay, for example, if a person is having cataract, okay, so which is the cataract which affects the eyes. Okay, so in those situations also we will do the surgery. Then recommended means the client should be operated upon, for example hemorrhoids. Okay, so these are needed, because if you don't operate that hemorrhoids, later on what happen, the person might have some bleeding. Okay, then he might have severe constipation. Okay, it might occur and it will really affect his health. Then optional, whenever we say optional, means these are those surgery which it's not so compulsory. Okay, it depends on the patient whether he wants to go for the surgery, or even though if you don't want to, so it's not that necessary. Okay, that is called as optional. For example facelift and all those. Okay, so these are the different types of degree of urgency. Okay, different types of surgery, like we have the emergency and immediate and urgent. Immediate means it needs to be done, okay, within 24 hours, or it can be done within 1 to 2 hours. Okay, then elective mean these are those which are already surgery which are already been planned or which are already been fixed. Then according to the degree of risk, we have the major surgery and the minor surgery. So when we say major surgery, that means here a very high risk is involved. Okay, so for example, a open heart surgery. So open heart surgery also, it's a very risky surgery. Okay, so even if you, what happened in a hospital, whenever we make the patient go for these type of surgery, we usually give them some high risk consent, so where we already explained to the individual as well as to his family. Okay, so after do with this surgery, what are the things which is, what are the risks of involved with that. Okay, so that at least the family also, they should be prepared beforehand if anything happens to the patient. Okay, so in those, these are the major surgery. So this actually, it involves a very high degree of risk to the client for a variety of reasons with many complications involved. Okay, so for example, I have given, there is a open heart surgery. Then a minor surgery is like these type of surgery, even if you do it, it doesn't have any serious complications and there is no life threatening involved. Okay, in this type of surgery. So for example, is a tonsillectomy. Okay, so this tonsillectomy is usually done whenever the tonsils, it gets enlarged or it causes lots of pain and all that. So in those situations, they is to removed. So this is called as a tonsillectomy. Okay, so this is actually what are the different types of surgery. Okay, so we have discussed about the according to the purpose, according to the degree of urgency, and according to the degree of risk. Okay, so related to the perioperative, I have told you, right? So under this, actually, we have three phases. So all these three phases, I will discuss one by one in the next class. Okay, so we will see what are the things we have to do for the patient during the preoperative phase. What are your role as a nurse? What you should do for your patient, okay, before he goes for the surgery. Then intraoperative means during the operation period, what is the things that you have to do for your patient. Okay, so what type of care you need to provide for your patient. And post operatively means after the surgery. Okay, so every time pre means before and post means after. And when you hear the word intra, means it is during that particular time or during that particular period. Okay, so are you all clear? Do you have any question related to this? Okay, so this is all about what are the surgery, okay, and what are the different types of surgery. Okay, so these actually I'm giving you just to brush up because it's better you know about what are all these. Okay, so before going directly to the topic on preoperative nursing, so anyone have any question? Yes or no?
No, ma'am.
No, ma'am.
No, ma'am.
Every time, okay, every time, no, no. I don't know so far how it's really whether you understand or not. Do you understand?
Yes,
Yes,
sir.
ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, I will only when I'll give you exam and all. So if you're able to write, then only I will know that whether you really understand or not. Okay, because now, so if I ask, so nobody
Ma'am,
ask question. Yes,
ma'am, what will be amputation then? Under which category it will fall?
what amputation? Actually, amputation now it
Yes,
falls
ma'am.
in many category if you think, because sometimes what happen, suppose if it can comes under your preventive also. For example, if a person have any cell injury or any form of infection in the leg, in a particular part of the body also, right? So in those time, what happen, an individual, we have to remove that particular part. If you don't remove it, what happen, that infection might also spread to the other part of the body. So it acts as a preventive type of surgery also. Okay, and mostly it is
Okay,
preventive
ma'am.
if you say amputation.
Mm,
Okay, because it does
okay,
not
ma'am.
fall under reconstructive or all this. Okay, because once we amputate it means totally the person will be disabled for life, right? So it is acts because actually some it depends also some situation. But suppose for example, if he's already having any form of disease or anything, okay, or any injury or any form of infection, okay, in the particular hand or in particular limb, so if you amputate that, then it comes under preventive. So exactly, actually, there is no exact this one category where it falls, but it depends on the situation also. Okay.
Okay, ma'am.
Then any other question? Hmm? No. Okay, so these are the different types of the surgery. Okay, in the next class, we will discuss about the preoperative intra and the post. Okay, post of those are very important. Okay, everyone, then I will wind up the class. Okay, so
Thank you.
okay, okay, thank you,
Thank you,
everyone.
ma'am.
Thank you, ma'am.
Thank
Thank
you,
you,
ma'am.
ma'am.
Thank you,
Class in the
ma'am.
group, so you can go through. And you already have you bought the book or not? F1 book.
Yes, ma'am.
Yes, yes, ma'am.
Yes, ma'am.
No, ma'am.
Okay,
No,
anyway,
ma'am.
you can, for now, for the time being, you can refer the notes which is provided by us. Okay, so when you get your book, then you can, for further information, you can refer your book. Like I've said for anatomy and physiology, so you can refer Rose and Wilson. So whatever, it is up to you. If you don't, even if you don't write the notes, also it's mostly I have referred from there only. So you can directly refer from the book. Okay, fine.
Okay, ma'am.
Okay.
Okay, ma'am.